Curious about a career as a physician assistant? In this video, we'll talk about what physician assistants do, why they are essential to the economy, what skills you'll need for this career, industries you can expect to work in, schools and programs that will equip you for a physician assistant career, and other resources. So, what exactly is a physician assistant? A physician assistant, also referred to as PA, is a licensed medical professional who works with teams of doctors, surgeons, and other healthcare workers, handling common illnesses and minor procedures. A PA works with patients of all ages in virtually all specialties and primary care areas. He or she may also be referred to as a physician associate. PAs are often the first to attend to a patient. In case the patient has an advanced condition, PAs refer the patient to a specialist. In general, physician assistants review medical records such as a patient's history, diagnostic tests, and research on the latest treatments to ensure informed choices in patient care. In addition, PAs examine patients, diagnose minor injuries and illnesses, and prescribe treatment. They also educate and counsel patients and their families, and are involved in outreach programs, talking to specific groups about managing diseases, and promoting wellness. Physician assistants often work alongside doctors, but their specific duties and the extent to which they must be supervised by physicians or surgeons differ from state to state. The Vietnam War in the 1960s created a shortage of doctors in the United States. This triggered the introduction of the role of physician assistants. Today, doctors are able to see more patients when they work alongside PAs. Physician assistants provide first aid, preventing further complications, and saving lives. They have become more autonomous and crucial, especially during the COVID-19 pandemic. In smaller clinics, a PA may serve as the principal healthcare provider. Such clinics that don't require a doctor have been set up across the country, assuring citizens of accessible, affordable, yet high-quality medical attention. Even in medical specialties where there are plenty of doctors, PAs are an important part of the practice, helping to reduce wait times and improve access to care. Skills needed for physician assistant career. The following are some of the skills needed to succeed as a physician assistant. Attention to detail, to ensure patients get the right treatments and medical interventions at the right time. Empathy, to understand and respond to a patient's situation in a way that eases their anxiety and assures them that they are getting the right care. Independence, to perform certain procedures without guidance from the specialists when required. Flexibility, to cope with an ever-changing work schedule and to be on call at short notice. Industries that require physician assistants. PAs work in a number of medical settings. These include hospitals, nursing homes, medical offices, community health centers, retail clinics, workplace clinics, schools, correctional facilities, and armed forces bases. Depending on the facility, they may have titles such as anesthesiologist assistant, orthopedic physician assistant, pediatric physician assistant, radiology practitioner assistant, and surgical physician assistant. As mentioned earlier, if they end up working in a smaller clinic that does not require an on-site doctor, PAs may have the title of principal healthcare provider. Economic outlook. According to the U.S. Bureau of Labor Statistics, the top 3 highest paying states for physician assistants are New York, with an annual mean wage of $126,370, California at $135,180, and Texas at $112,200. Check out the U.S. Bureau of Labor Statistics website in the description to see the data for your state or the state you're interested in working. Your next steps. PA programs take between 24 and 27 months to complete. If you want to work during your PA program, some schools offer a 3-year part-time option. According to Mayo Clinic's College of Medicine and Science, the typical pathway to becoming a certified PA, PAC, includes 1. Obtaining a bachelor's degree with emphasis in the sciences. Most universities have pre-PA degrees. 2. Completing a physician assistant program that has been accredited by the Accreditation Review Commission on Education for the Physician Assistant, ARC-PA. 3. Completing a licensure requirement. After successful completion of a PA program, candidates must pass the Physician Assistant National Certifying Examination, PANCE, from the National Commission on Certification of Physician Assistants, NCCPA. Once certified, PAs can practice under the credentials of Physician Assistant Certified, PAC. From there, you will need to take 100 continuing education credit hours every 2 years and a recertification exam every 10 years. There are multiple options to enrolling for the Physician Assistant program. Schools like Touro University in Nevada, Normandale Community College in Minnesota, and Community College of Baltimore have a 2-year program. You also have the option to study online for a Physician Assistant Master's program. Your choices include University of Michigan Flint, Virginia's community colleges, University of New England. If you're interested in physician assistant as a career, you can check out some of the schools mentioned here. Visit their websites and search for more information. You can also contact the program representatives, and I'm sure they'll be happy to provide you with more information on their school and admission process. Most of the schools I have mentioned here also offer financial aid and scholarships should you happen to need funding for your studies. The ball is in your court now. Do your research, talk to your guidance counselor at school or professionals who can help you understand more about the field. Research schools and programs that will be a good fit for you. And most importantly, believe in yourself and keep your dreams alive. Please share this video and don't forget to like and subscribe to the channel. See you in the next one.